Today, we're going to talk about a whole new way to fix bad sleep by going straight to the root of the problem. This approach, which is based on the work of Dr. Mariam Saifi, isn't about just managing symptoms. It's about actually correcting what's wrong in the first place. So let's dive in and see how it works.
All right, let's start with a really simple question. Do you always feel tired? You know, that constant nagging fatigue that even a few cups of coffee just can't seem to shake? If that sounds familiar, it might be a big sign that something deeper is going on while you're supposed to be resting.
And what if the answer wasn't about getting a new mattress or changing your bedtime? What if the real cause is actually in your mouth? I know, it sounds a little strange, but there's this powerful and often overlooked connection between the shape of your jaw and how much energy you have every single day.
Okay, so here's our game plan. First, we'll look at why we sleep so poorly. Then we'll compare temporary fixes, what we're calling crutches, to a real solution. After that, we'll get into how you can actually renovate your airway, why starting young is such a game changer, and finally, how breathing better truly helps you live better.
First up, why are so many of us sleeping badly? Well, the big idea here is that the problem often isn't about sleep itself. It's about our physical anatomy. We're going to shift our thinking away from the symptom, which is bad sleep, and focus on the structural cause. And a major culprit here is something called obstructive sleep apnea. Basically, this is when your breathing literally stops and starts again all night long because your airway gets blocked. Just imagine your tongue or other soft tissues falling back and completely cutting off your air supply. Your body is basically fighting for oxygen over and over all night.
So, do any of these sound familiar? Things like really loud snoring, waking up gasping for air, having a super dry mouth in the morning, those nagging morning headaches, or just feeling exhausted all day and finding it hard to concentrate. These aren't just minor annoyances, you know. They're basically alarm bells from your body, telling you that your breathing is being compromised at night.
And that leads us right into this really crucial idea, the difference between using a crutch and finding a real solution. It's so important to understand that just managing symptoms is not the same thing as actually curing the problem. There's a huge difference between just getting by and truly fixing what's wrong.
This slide just lays it out perfectly. On the left, you've got the traditional approach, things like a CPAP machine, which you basically have to use for life. It's a classic crutch. But on the right, you see a totally different philosophy, biomimetic therapy. That fancy word just means it mimics your body's own natural processes. This is a treatment with a finish line, usually around 18 months, that aims to correct the structural cause so you hopefully don't need a machine forever. And this analogy it hits the nail on the head. It's the difference between using crutches to walk and actually healing the leg. One approach lets you function with the problem, while the other one aims to solve it for good. Okay, so how do we actually heal the leg in this situation? This is where it gets really fascinating. In this section, Renovating Your Airway, we're going to see how dentistry can literally reshape the way you breathe.
The technique is called biomimetic oral therapy. And again, that key word, biomimetic, means it copies what your body does naturally. So by using a special oral appliance, often from a system called Vivos, this therapy doesn't force anything. It gently encourages your jaw and your airway to develop correctly, creating more physical space.
So how does this actually work? Let's break it down into 4 simple steps. First, the appliance gives a little bit of gentle stimulation inside your mouth. Second, that encourages your jaw to naturally grow and develop. This growth then expands your palate and dental arches, which means third, you get more space. And what's the end result? A wider, more open airway where your tongue has plenty of room and air can finally flow freely.
And here's the part that is just a total game changer. This isn't just for kids. These custom appliances, they have names like DNA and mRNA, which are just brand names and have absolutely nothing to do with genetics, can actually stimulate this kind of growth even in adults. It turns out the body has this amazing ability to remodel itself, and we can achieve changes that people used to think were impossible. And the results? Well, they really speak for themselves. According to one study, nearly 97% of patients using this kind of therapy reach their treatment goals. That is an incredibly high success rate for a non-surgical solution that's aiming for a permanent fix.
Now, as effective as this can be for adults, there's actually an even better way to approach it. And that brings us to our 4th section, starting young. This is all about preventing the problem before it ever has a chance to fully develop. The sources we looked at strongly recommend getting kids checked as young as 7 or 8 years old. So why that early?
Well, it's because at that age, a child's upper jaw bones haven't actually fused together yet. That means the jaw is still moldable, which creates this perfect window of opportunity to guide its growth and make sure the airway develops correctly right from the very beginning.
And the long-term benefits of doing this early are just huge. You can potentially head off a whole domino effect of health issues later on. You can make sure there's enough room for their adult teeth to come in straight, which might mean they can avoid complex orthodontics or even jaw surgery down the road. And maybe most importantly, you can dramatically improve their sleep quality and even their behavior right now. This all brings us to our final section, Breathe Better, Live Better. This is where we see how all these different pieces come together in Dr. Sefi's integrated approach, which is really what makes this kind of specialized care possible in the first place.
She has this really unique two-part model. On one side, there's StarBrite Dental. That's her comprehensive practice where airway evaluation is part of every exam. And on the other side, there's Breath of Life Dental, or BOLD, which focuses only on airway health and sleep apnea. They work hand in hand to create a complete system of care.
And this dual setup is so important because it ensures that airway health isn't treated like some separate, isolated problem. Instead, it's considered a fundamental part of every single dental checkup. So even if a patient just comes in for a routine cleaning, their breathing is still on the radar.
It really all comes back to this one core philosophy. The mouth, the jaw, the airway, and sleep are an interconnected and inseparable system. You just can't treat one part effectively without thinking about all the others. They all work together, for better or for worse.
So we want to leave you with this one powerful question to think about. What if the solution to your fatigue, your headaches, or maybe even your anxiety all began with the way you breathe? It's a thought that kind of reframes everything, suggesting that the path to better overall health might just start with a clear and open airway.